I'm happy to introduce our first speaker, Ben Wikler. Ben's been leading the healthcare fight at MoveOn.org and helps make sure that your grassroots actions are heard by representatives in D.C. He's from Madison, Wisconsin, and fun fact, his first jobs were selling Coca-Colas at Badger football games and also writing for The Onion, which I just found out. Ben, are you there?
I'm here.
Great. What are we going to do about Obamacare and repeal?
Thanks so much, Amanda. And thanks to all the thousands of people who are on the phone and listening online right now. We are at the all-hands-on-deck moment of the healthcare fight. So what we're going to talk about is where we are, how we got here, what Trump Care is, the Republican proposal, why they're trying to push it through, when they want to do it. I'll just give you a preview. It is in the next 3 weeks. Who we need to convince if we're going to stop this from happening, and what we're going to do to stop the Republicans. So, first of all, where are we? Right now, we're at this crazy moment in American history where the uninsured rate, the rate of people who do not have health insurance, is at an all-time low because the Affordable Care Act, which is not perfect, but because it is so much better than what we had before. And at the same time, we have a government in the hands of people who voted 60 times to repeal the Affordable Care Act. We thought after Trump was elected and Republicans had controlled both houses of Congress that the Affordable Care Act was a goner. It seemed inevitable that they would be able to repeal it right away, and their plan was to repeal it by January 20th. That was their stated goal. The date that Donald Trump was sworn into office, he was supposed to get the repeal bill and sign it into law. But starting the day after his election, there were protests all across the country. The day after the inauguration, instead of repealing the Affordable Care Act, Trump was reeling as he watched 5 million people in the streets in the Women's March. And they've been so stunned by the uprising that they have made almost no progress. Recently, all of us took to the streets and took to town halls during resistance recess. We think 100,000 people participated in actions during the congressional recess. And that scared them so much that they suddenly realized that if they didn't repeal the Affordable Care Act and attack our health care now, they might lose their momentum entirely and never do it. So they basically decided to throw a Hail Mary pass. They said, holy smokes, it's now or never. And suddenly we're in this turbo mode, this race, where they're going to try to torpedo healthcare for millions of people, and we have 3 weeks to stop them. So that is where we are. That is how we got to this moment. What is Trump Care? They introduced this bill last Monday, out of nowhere, right after the congressional recess. Here's what their plan is. The Affordable Care Act is based on 3 big pieces. The first is the guarantee that insurance companies can't turn you down no matter what your pre-existing condition, matched with the requirement that everyone buy insurance so that everyone's in the system. Healthy people help make sure that there's money in the system to help pay for care for less healthy people. The second thing is financial support for people to be able to buy individual insurance. That comes in subsidies. Most people who buy insurance through the Affordable Care Act get significant subsidies. And it comes through support for what's called cost sharing. So if your copays are high, your deductibles are high, the Affordable Care Act ensures for most people who are covered by it that they can't spend more than a small fraction of their income on their health insurance. And the third thing is the expansion of Medicaid. So Trump Care is an attack on all 3 of these pillars of Obamacare. It is a terrible, terrible, terrible plan. Their first idea is to make people pay more. They do this by, instead of having the subsidies be based on what your income is and what you can afford to pay, they just give everyone a flat amount. It does not cover anywhere close to as much as the subsidies under the current law. For the average person, the cost rises by $1,542 in the first year. It's much worse for older people. If you're between 55 and 64, under the Trump Care plan, insurance companies can charge you 5 times as much in premiums, and you get a $4,000 subsidy, which doesn't come close to covering the amount that health insurance will cost. So for the average person, over the next 3 years, the average cost that they'll pay will be almost $7,000 higher per year, which so many people can't afford. And it's because of these massively increased costs that more than 15 million people are likely to lose their health insurance coverage. Now, that's an estimate by a bunch of really smart outside economists, but the official number of people who will lose their coverage under the Affordable Care Act is not yet known, because that number, the official score, is calculated by the Congressional Budget Office. Republicans are trying to have started the process of trying to pass Trump Care before the Congressional Budget Office weighs in, because there's a breach of every normal protocol and system used for passing laws. That's what Republicans do when they're terrified of the truth getting out. To back up on the other two things that the Trump Care does, it increases costs, it attacks Medicaid, so it ends the basic structure of Medicaid, which is a safety net that protects everybody, and it also defunds Planned Parenthood. Medicaid basically would be cut by hundreds of billions of dollars. If a state had really high Medicaid costs, they wouldn't be reimbursed for it. That means millions of people will lose their coverage as well, and Planned Parenthood you'll hear more about from the next speaker. So why are they doing all of these terrible things? Like with so much Republican policy, there's a simple explanation: tax cuts for the rich. The Affordable Care Act actually made the deficit go down. It was a great thing for the federal budget because it was paid for by small taxes on the wealthiest Americans. Their main goal with the Affordable Care Act is to get rid of those taxes. So the average middle-class family gets $0 a year under the Trump Care tax cut. If you're one of the 400 richest Americans, you get $7 million per year, every year, in tax cuts. And if you're an insurance company CEO, you get your own special tax cut if you make more than $500,000 per year. So the very rich get very richer, and 15 million people can't afford their health insurance. That is the core of Trump Care. It is a bad plan. Now, it's so bad that if people hear about it and learn about it, it really doesn't stand much chance of passing, which goes to when they're planning to do this. So we talked about the what, we've talked about the why. Now we're talking about when. They're trying to rush this thing through in 3 weeks. The Affordable Care Act, you might remember, took about a year and a half to pass. It went all the way from Obama's inauguration until March 23rd of 2010. Again, more than a year later. They're trying to repeal the Affordable Care Act and pass Trump Care by March 23rd of the first year they're in office, after introducing it again just last week. They've already voted it through 2 committees without having the official score from the Congressional Budget Office. The entire House is expected to vote on it the week after next. So this coming week, it's the Budget Committee in the House. The week of March 20th is when they expect the entire House of Representatives to vote on it. And the following week, the plan is that they will take the exact bill passed by the House, skip all the committees in the Senate, have no amendments, go directly to the Senate floor, and introduce the bill under what's called reconciliation rules, which basically means it's a train that nobody can slow down, and it only takes 50 votes plus one, meaning Vice President Pence can cast a deciding vote. It only takes 50 plus one votes to pass. Democrats don't have the power to filibuster it. If they continue with that plan unimpeded, they will pass this thing. They will hurt millions of people. And that is why we need to slow them down and stop it. This is a full-on healthcare emergency. But we actually have, I think, a really good shot at stopping these guys. So who could possibly stop the Trump Care, the American Health Care Act is what they call it? The 2 numbers to remember are 22 and 3. In the House of Representatives, we need 22 Republicans to join us. In the Senate, we need only 3 senators. Every Democrat, as far as we can tell, every Democrat is going to vote against this monstrosity. And a bunch of Republicans are now queasy about it. Some of them are queasy from the right. They think it's not cruel enough. They want to throw everyone off their health insurance who got coverage under the Affordable Care Act. But there's also a lot of more reasonable Republicans who are concerned that this will just hurt people, and they don't need to do it. They don't want to do it. So if you're watching online, we have a slide that shows our key Senate and House targets. I won't go through all 23 House targets, but they're the 23 Republicans who represent House districts that Hillary Clinton won in 2016. In other words, these are already anti-Trump districts. We think that out of these 23, there's a bunch of them we might be able to flip, maybe most or all of them if momentum moves in our direction. In the Senate, we only need 3 senators, but we have 9 top-tier targets. Those are, if you have a pen handy, Lisa Murkowski in Alaska, Tom Cotton in Arkansas, Jeff Flake in Arizona, Susan Collins in Maine, Dean Heller in Nevada, Rob Portman in Ohio, Shelley Moore Capito in West Virginia, John Cassidy in Louisiana, and Cory Gardner in Colorado. All of those senators have publicly expressed their reservations about Trump Care. All of those senators are people who might actually vote against it or publicly commit to voting against it in a way that slows down the momentum. Now, how do we get these senators, these representatives to stop it? And especially if you're not one of their constituents, how can you help to get these guys to vote against this terrible law. We have a plan. The folks on this call have been doing amazing work protesting outside of congressional offices in states all over the country. We now want to escalate that. Rather than just showing up once and doing a protest, our plan next Thursday and Friday, which is a brief Senate break, so senators will be home in their states, we want to do stakeouts of their offices. We're calling it congressional stakeouts to save healthcare. Congressional stakeouts to save healthcare on Thursday and Friday from 7:30 a.m. to 7:30 p.m. We're asking folks to go, bring your lawn chair, bring signs, bring crutches, bring slings, bring medical equipment. If you have a stretcher, bring your stretcher. Bring whatever you can to show that this is a healthcare emergency and go outside of their offices. We're asking folks to sign up for 1-hour shifts. You can sign up for as many shifts as you like. Take the day off if you like. And we'll be having these actions outside of the entrances and exits of the congressional offices throughout the entire day on Thursday and Friday, so that anytime any staffer goes in or out of the building, anytime a senator walks in or out of their office, anytime a person from the media or an interest group is coming to lobby them they see us there protesting. You can go before work, you can go at your lunch break, you can go after work. Those will probably be the biggest times, or you can go whenever it works. And if this catches fire, it's something we might extend past next week. So, congressional stakeouts to save healthcare. And if you're not in one of these states, if you're not in one of these targeted districts, you can call people who are in these districts and ask them to show up. So this is a national effort. It's almost like an election where we're focusing on the swing districts. We're asking folks to be there around the clock, and folks across the country can help to call and recruit volunteers. That is our battle plan to raise the stakes immediately. There's other stuff in the works. We'll hear more on this call, but I want to ask, as we close out this section of the call, if you can commit to getting involved in one of these actions. Press 1 if you can visit your congressional office. Press 2 if you can make some calls to recruit people from home or send text messages from home. 1 if you can go to a congressional office visit. 2 if you can recruit from home. I'd love to get a sense of where folks are on this call in terms of getting involved. Again, Ben Wikler here with MoveOn.org, and this is really it, folks. These next 3 weeks are the time to stop Trump Care, and if we win, this turns around the momentum and energy for the entire legislative agenda. This is an all-hands-on-deck moment, and I think we can really step up to this fight. I'm excited now to introduce our next speaker. Kelley Robinson is the organizing director of Planned Parenthood. She's a terrific advocate. She's a board member of Sister Song, a national women of color reproductive justice collective, and she will take it away with the I Stand with PP campaign, I Stand with Planned Parenthood campaign, what's at stake in that fight and how that's going to work. Thanks.
Great. Thanks a lot, Ben, and thanks to everyone for having me on the call. Woo! If you're not fired up right now, you must not be listening. Ben really did do a great overview of exactly what's going on related to the Affordable Care Act. I have to say, sometimes folks ask me what's at stake right now in this particular moment, and I say everything. Literally everything is at stake, and particularly with what's happening around the Affordable Care Act and them trying to repeal it. We're on the verge of a national health care disaster that we have got to take action around. But the good news is that we're fighting back and we're winning. Republicans, like Paul Ryan said, they stated they wanted to repeal and replace Obamacare by January 20th. And guess where we are right now, in the middle of March. That's called progress. That's what victories are going to look like right now. And sure, we're in a moment where our wins are going to come by inch, or are going to come in the shape of inches. But every day that we're able to delay is a victory for us and for our movement. And for us at Planned Parenthood, every day that we can push back this effort to defund our organization means that we get to serve 8,000 patients at Planned Parenthood Health Centers. So this work that you're doing matters. It is time for us to turn up for justice like we've never done before. And by turn up, I mean get creative, get innovative, and be relentless. So I want to tell you just a little bit about the Stand with Planned Parenthood campaign, what you can expect and ways to take action. For us, there are 4 things that we're really holding at the center of all the work that we do in this moment. Number 1, we want to ensure that Planned Parenthood doors stay open. We serve 2.5 million people every year. 1 in 5 women over the course of their lifetime will come to a Planned Parenthood. It is critically important that we keep these health centers open and providing access to health care for all. Number 2, making sure that everyone has access to health care, no matter where they are or how much money you've got. That means for protecting the Affordable Care Act. Millions of folks have been covered under this monumental piece of legislation. It's critical that we keep it in place. Number 3, We're protecting access to safe and legal abortion. And number 4, our goal is to keep families healthy, keep them together, and fight against all the racist and dangerous attacks on immigration, on women's health, and on our families. Now, I think that this is all really important because when I say stand with Planned Parenthood, I'm not only talking about our brick-and-mortar facilities, I'm talking about standing with everyone that comes in the door of Planned Parenthood, standing with immigrants, standing with refugees, standing with LGBTQ folks, because that's what matters. All of our lives are at stake with the same targets that Ben talked about earlier. The same folks hold decision-making power over just about all of our fate. Particularly to my organization, I am so determined to make sure that our doors can stay open so that we can continue to provide the critical life-saving care that we do to so many people in so many communities. Many of you that are looking at the live stream, there's a couple of stats that are on your screen right now that just give you a little bit of a snapshot of the work that we do at Planned Parenthood. At the end of the day, Planned Parenthood is the solution to so many of the challenges in our communities, not the problem. And we have to make sure that when you hear language like defunding Planned Parenthood, that you help us to decode what that really means for folks in the world. Because defunding Planned Parenthood is really just code for taking away health care access to 2.5 million people across the country. What this bill does is specifically block people with Medicaid coverage from accessing preventative health care at Planned Parenthood health centers. These services that they're preventing people from accessing include birth control, cancer screenings, STI testing and treatment. Y'all, we are at a moment when teen pregnancy is at the lowest it's ever been in a generation, where we're making strides in reducing STIs and STDs, sexually transmitted diseases, across so many communities. This is the moment where our work is working. We cannot afford to lose ground and lose the health of our communities by having Planned Parenthood health centers not be available to folks. So that's what we're really out here protecting and fighting for. In addition, more than half of our health centers are located in rural areas or places where there are a shortage of other healthcare professionals available. So if you talk about not funding a Planned Parenthood, you're talking about taking away access to full communities, to full counties of people. That's something that is unacceptable and is exactly why we're seeing millions of folks stand up and stand with Planned Parenthood. And just to give you a little bit more of a sense of what this looks like, when folks are talking about this bill and this piece of legislation, we have to really make it clear that there's no line item that the federal government has that funds Planned Parenthood. No, that is not the case. What happens is that folks across the country will go to a Planned Parenthood health center to get preventative care services and family planning services, again, like birth control and STD screenings. Then what Planned Parenthood does is submit a claim to Medicaid in the state, and the state's Medicaid program reimburses Planned Parenthood for the service that we've been provided. Then the state will go to the federal government to get some resources back into that state for the service. So really, what Planned Parenthood does is we're able to provide services to folks at low and no cost all across the country and get reimbursed for those services just like any other healthcare provider. That's important work that we do. And what we want to do is be able to continue offering free and low-cost services to the millions of folks across the country, because that's what's making an impact in healthcare access across the nation. In order to do that, we have to stand with Planned Parenthood. We have to stop this attempt to defund our organization. So, like I said, we're fighting back here and we're winning. We are making incredible strides, and every day we're able to serve 8,000 people by delaying the impact of this terrible legislation. What we need you to do is to continue to stand with us so that we can win this fight once and for all. We're asking you to do 3 things right now. Number 1, share your stories. Let legislators know that this is not about politics. This is about people's lives. Tell your stories about how Planned Parenthood has been a critical part of the fabric of your community. 2, call. It's time to hit those phones. Commit to making 3 calls a day, every day, to your member of Congress and to both of your senators, telling them that you stand with Planned Parenthood. Now, if you're in an area where you've got a supportive member of Congress, it is just as important for you to call if you're if you're in an area where you have a not so supportive member of Congress. Our champions need to hear from us and know that we are the wind beneath their wings, and we have to kind of push folks that don't yet know that they need to be standing with Planned Parenthood too. And number 3, as Ben said, we've got about 18 days left in this fight, 18 days that can make a difference. One big day of action that we have coming up is March 23rd, the AHCA anniversary. Next week on this call, you'll be talking about ways to get involved and take action. But mark that date on your calendar. March 23rd is the AHCA anniversary, and it's a day that we want to turn out and turn up for reproductive rights in our communities. If you want more information about how you can get activated and involved with Planned Parenthood, visit our website, istandwithpp.org/act. You can find out so many ways to get involved, and we need you. This is a moment to stand with Planned Parenthood because we're standing with all of you. Thank you.